Cervical incompetence. Now, for the diagnosis, history is very important, and in this the patient will have a history of recurrent pregnancy loss, and these will be the second trimester loss, in which there is painless dilatation of the cervix followed by expulsion of the fetus, which is again painless. And if the patient is a multigravida, then as the number of pregnancy loss are increasing, the period of gestation at which the loss occurs, it decreases. That is, if a patient has cervical incompetence, then successive pregnancies will abort at lesser gestational ages. And the diagnosis in non-pregnant state, it is not very conclusive. We do not have many methods. Although you can use Hagar's dilator, and if Hagar's dilator number 8 passes easily through the internal os without patient's resistance, without patient feeling the pain, then it is diagnosed as cervical incompetence. Apart from this, hysterocervicography can be done, and in this what we do, we insert a foleys catheter inside the uterus and a radiopaque dye is injected. In normal patients, since the os is closed, so this dye will not come out. Whereas in cases of cervical incompetence, since the os is open, the dye comes out, and so the cervicography done will give a funnel shaped appearance. Now, this was in the non-pregnant state or in the interpregnancy interval, but to diagnose this when the patient is pregnant, in that case we do a transvaginal ultrasound, and in this normal cervical length is ideally 3.5 centimeter. If the cervical length is less than 2.5 centimeter, as you can see here, this is the cervical length between the internal os and the external os. So, if this length is less than 2.5 centimeter, or the dilatation of the cervix is more than 2 centimeter, or the shape of the cervix, which is normally T-shaped, it becomes U-shaped. As you can see here in this image, this is the normal T shape of the cervix because the internal os is closed here. Now, if this internal os starts dilating, the shape of the cervix becomes Y-shaped, and as it dilates further, this becomes V-shaped, and with dilatation of the cervix more than 2 centimeter, this will become U-shaped. The cervix becomes U-shaped, and this is suggestive of cervical incompetence.